Class 1 amalgam restoration. Arrange appropriate armamentarium before triturating amalgam. We use the following amalgam at UTSD: Valiant PhD Extended Set. A triturator will be used to mix amalgam. Place the amalgam capsule in the mixing arm. Mix for 10 seconds. Use a mirror handle to break the seal of the amalgam capsule. Transfer the amalgam into a well. Load both sides of the amalgam carrier with amalgam. Insert small increments of amalgam. Use the small end of the condenser to pack amalgam. Condense toward all the internal line endpoint angles. Continue inserting more amalgam into the preparation. As you get closer to the occlusal, you may change to a larger condenser tip. Less force is needed. Overpack the amalgam beyond the margins. Use a carver, anatomical or cleoid discoid, to place the initial central and secondary grooves. Periodically clean the tooth surface with a microbrush for better visual access. Place a carver, Hollenbeck or cleoid, along the cavo surface margin to remove excess amalgam. To avoid submargination of the amalgam, use the tooth anatomy as a guide. As more excess amalgam is removed, refinement of the central and secondary grooves will be needed. Continue carving until appropriate anatomy is achieved. Use a burnisher to achieve better marginal adaptation. Check for marginal adaptation by running the Explorer tip from enamel to amalgam and from amalgam to enamel over all the cable surface margins. Dispose of any excess amalgam appropriately. When handling amalgam, protective eyewear, mask, and gloves must be worn at all times in the preclinical lab. (1.5 to 1.7 millimeters).